Bruce Springsteen and the E Street Band postponed 8 shows this month due to a health issue for Springsteen. The 74-year-old rock legend was diagnosed with peptic ulcer disease. It's a common, often painful stomach affliction. So joining us right now, Dr. Payal Kohli. Let's get right into it. What is peptic ulcer disease?
Yeah, I just asked you guys if you'd ever heard of it.
Never.
Very common. Up to 10% of us will actually have it in our lifetime. And it is exactly what it sounds like. It's an ulcer or a sore in our GI tract, most commonly in our stomach or the first part of our small intestine called the duodenum. And you can imagine this is a unique part of our body, right? Because there's acid in it. And the acid can erode away the cells, but they're lined with something called a mucosa to sort of protect them. So if you have a condition that either makes too much acid or your mucosa kind of wears down and isn't protective, you can start to develop these ulcers.
As you're describing this, it just sounds so painful. Other than intense pain, I would imagine, like, what are the symptoms of this? How do you even know if you have it?
Yeah, so 30% of us can actually be asymptomatic and not know we have it until we develop a complication. But for the majority of people, they're going to have this burning, gnawing sort of pain. Think about an ulcer on your skin. That's exactly how it feels on the inside, or an ulcer inside your mouth. For some people, depending on the location of the ulcer, the symptoms get better with food, right? Because you neutralize some of that acid. For others, it gets worse with food because it can create some more production of that acid as well. And you can also have problems with satiety, so you're getting full really easily, nausea, vomiting. But a lot of people, like I said, will present with blood in their stool when the ulcer starts oozing or bleeding. And that's when they do endoscopy, look in there and see those erosions.
Whenever I think of an ulcer, I always think of spicy food and stress, two of my favorite things. Are those causes here, or what causes this?
Yeah, we all have that in our life. And interestingly enough, the two most common causes are neither of those. The most common cause is non-steroidal anti-inflammatory drugs, which is like ibuprofen, Aleve, Motrin, because those erode away that lining of the stomach. We can also get it from a bacterial infection called Helicobacter pylori, which many of us have that organism that lives inside of us. Not everybody who has that organism gets peptic ulcer disease, but that creates chronic inflammation. Now, alcohol can certainly exacerbate it because that also irritates that lining of our stomach, as we all know, the next morning. Sometimes you have a bit of a tummy ache after. But stress and spicy food can exacerbate your symptoms, but they're not necessarily causes of this condition.
Okay, so we know what to stay away from, but as far as a treatment, you're going to the doctor, you realize that you have this. How can you treat it?
So you have to be aggressive with the treatment. So think about an ulcer on your skin. How do you treat it? You allow it to heal without preventing more damage. And the way we do that in the stomach is we give you a proton pump inhibitor, something that suppresses stomach acid. And most ulcers will heal within a few weeks if they're small. It can be for several months that it takes to actually heal. But don't leave it undiagnosed, because the complications of this ulcer disease can be bad. Bleeding, we talked about. It can also lead to something called perforation, which is, it can actually erode through the entire lining, poke a hole, which is a life-threatening emergency. And then if you have that bacterial infection, you also will need antibiotics. So if you're having any kind of symptoms, especially related to food, gnawing, burning, aching, nausea, vomiting, talk to your doctor, because you may need an endoscopy to look for this condition.
Who would have thought the boss is what gets us talking about all this?
I mean, I feel like when celebrities, they go through something, it's so painful for them, but it gets all of us talking, and we learn so much. So I feel so bad for the boss, but we're learning a lesson here for sure.
All right, Dr. Kohli, thank you.